let's talk more about curbing the spread of the pandemic. Joining us in the studio is Dr. Osinachi Ubani, a medical officer of health, mainland, also a public health physician. Thank you for joining us on the program. Tell us about the mainland where you operate, and also why does it appear that there are a higher number of cases there?
Okay, let's talk about Lagos mainland, not mainland, because we have this issue of mainland island.
Okay.
But I'm working in Lagos mainland, one of the 20 local governments in Lagos State. And in the past couple of days, we've seen many figures, positives coming out from Lagos mainland. Okay, so there are a few things that would have brought that rise. Number one, we have 2 of the 3 testing centers in Lagos State. In Lagos mainland, we have IDH, we have NIMA, and both of them are in Lagos mainland. So sometimes we have some patients who come out positive who don't necessarily reside in mainland, but because they've been tested in those 2 centers, they're all categorized as mainland. Okay. Again, when the state decentralized the sample collection sites, Lagos mainland was one of the first few that started sample collection in one of the PHCs, Simpson Primary Healthcare Center. And so before some other local governments started, we had started testing, collecting samples, and we had started seeing positive cases from the samples collected. So that also could have attributed. And then we have a major market, we have Oyinbo market, because I noticed that when the results are out, and then you're trying to arrange for the evacuation team, you find out that the addresses of those positive patients are not necessarily in mainland. The figures are high, very high, probably the highest in Lagos State. But not all the figures attributed to Lagos mainland actually reside in Lagos mainland.
So how do we explain the community transmission and the reason why we're seeing a lot more figures?
Okay, well, we have all established that there's community transmission now, because now we have people who have tested positive, who do not have any history of traveling, who do not have any contact with someone that has traveled, who have not housed, attended to, or been close to anybody that has been sick, and they have come out positive. One of the problems is that what we're seeing for now is like a tip of the iceberg. It's a novel virus. Many of the positive cases have come out asymptomatic. So even as both of us are now, until proven otherwise, we don't know who is positive or negative until you undergo the test.
So essentially more testing, or should people see themselves as possible potential carriers of the virus?
From the personal point of view, everybody is positive until proven otherwise through testing. And that's what Lagos State has tried to do, increasing the number of sample collection sites, improving on the number of testing per day so that more people will be tested, more results released, and then we can differentiate from the positives and the negatives.
Do you expect that the numbers would increase exponentially in Lagos?
Without sounding negative, yes. We have peculiarities. Lagos is very, very highly populated. And then we have a lot of slums, ghettos, where it's difficult to reach. We categorize them as hard-to-reach areas. That was one of the issues that happened in Lagos mainland. You have some slums with over 500 people living there, very poor living conditions, and then one person tests positive. Even for that kind of place, line listing, contact tracing becomes an issue. For some of those places, what we do is we invite the state mobile team, test as many as you can, and some of the results come out positive.
All right, well, we need to take a break now. We still have Dr. Osinachi Ubani, Medical Officer of Health, in the studio. We'll come back to continue this discussion on the pandemic. Do join us again. Dr. Ubani, tell us about the active case search is ongoing in Lagos. Do you think that this is really helping, and perhaps other states need to adopt them?
It's one of the very good strategies that Lagos State has employed in this fight against the coronavirus. Apart from the active case search in the houses, house to house, we've also had active case search in the health facilities, because some of the positive cases we're seeing now came out from hospitals. So looking through their records in the past 1 month to see people that have had symptoms cough, fever, respiratory distress, and likes, would help to also find people who may not necessarily come out on their own to get tested. Some of those people are followed up, tested, and more positive cases are being revealed.
So essentially, this is looking like a virus that will stay with us for a long time.
Again, without sounding negative, that is very likely.
Do you suppose that a lockdown for as long as it will stay with us is needed, or perhaps we should start getting ready to live, alive, wearing the masks and the other protocols involved?
Okay, now, that is, from my point of view, where we're going to have to choose between the devil and the deep blue sea. Being locked down, Lagos has its peculiarities. A total lockdown may work perfectly in some other places. But in a place like Lagos, where you have a major percentage of the people as daily earners who, if they don't go out, they don't eat, implementing a lockdown for a long time may be counterproductive. Already we're feeling the tension, the pressure from the people because they want to get back to their normal lives. But on the other hand, I look at this pandemic like a war. Like someone said, it's because we're not hearing gunshots and bomb blasts and all that. So some people are still taking it easy. But it's a very difficult and tough situation. And at this point, I don't envy government for what choice they make.
So the face mask, we've been told now, many states are making it compulsory, countries as well. Wearing of it, we would need another sensitization on using the face mask, wouldn't we?
Yes. For now, the face masks are like, this is one of the disposable ones we have, which is fast going out of stock because of increased demand, reduced supply. And the truth is that because this virus needs access into the system, it staying on your skin necessarily doesn't get you infected, but it needs to get into your system and get into your lungs to cause active infection. So simple things like wearing of the face mask, hand washing, using of sanitizers, alcohol-based preferable, and general sanitation would help to keep the virus away. Because even if for any reason you would have touched surfaces and then you wash your hands almost immediately and you avoid touching your face, through which it can get into your protected.
All right. We'd like to appreciate your time. Dr. Osinachi Ubani, Medical Officer of Health, Mainland Public Health Physician. Thank you for joining us.
Thank you.